Stunning numbers to share with you tonight. A Canadian researcher has linked 80% of Canada's COVID-19 deaths to residential care settings. The data is being collected in hopes that it will help inform policy decisions as cases climb during the second wave. As cases balloon inside residential care settings, there is no public health agency compiling the nationwide numbers.
I cannot tell you how surprised I am that this list is tracked by me.
Nora Loreto has voluntarily taken matters into her own hands, collecting the information every night since April and sharing it on a public spreadsheet. There are nearly 800 facilities on the list. They include long-term care homes, retirement residences, jails and prisons, and hospital outbreaks. Of the more than 10,000 Canadians who have died from COVID-19, she's linked at least 8,100 to residential care.
In Ontario, you can see a lot of facilities where people were sharing up to 4 people in the same room had higher numbers of deaths than in places where patients or residents were living one to a room. So that has major public policy implications.
She's also tracking deaths among healthcare workers and deaths in workplace outbreaks.
What I am just so scandalized by is the overwhelming toll that this virus has taken on racialized communities and especially Black communities. The majority of people who've died working in the healthcare system have been Black. We're already seeing in a second wave that there has not been enough to fix these issues from the first wave as we're seeing cases continue to climb right now.
Loreto isn't alone in taking on the research independent of public officials. In an effort to learn even more about where COVID is spreading, a second team of researchers has created a global crowdsourced database of super spreader events where 10 or more people are infected. There are currently more than 1,500 events listed. Unsurprisingly, in Canada, the vast bulk of spread happens at long-term care homes, but there are also a number of large gatherings listed, like weddings and funerals, as well as workplace and industrial outbreaks, for instance, at meat processing plants. Some takeaways from their research: the vast majority of super spreader events took place indoors rather than outdoors, in settings where people were confined together for a prolonged period of time, during flu season in that location, and at food processing plants where temperatures are kept low. They are particularly vulnerable compared to other types of factories and plants. None of the researchers behind the super spreader database were available to speak with us today, but they did write on their webpage that their hope is to help public health professionals make decisions that will prevent these types of events from taking place. For City News, I'm Yazdani.